Angina, also known as angina pectoris, is a concerning symptom that should never be ignored. It is characterized by chest pain or discomfort caused by reduced blood flow to the heart muscle. This reduced blood flow means that the heart isn't getting enough oxygen-rich blood, leading to pain. Imagine a traffic jam in your heart's arteries restricting the smooth flow of blood. Angina is often described as a feeling of tightness, pressure, squeezing, or heaviness in the chest. The pain can sometimes radiate to other parts of the body such as the arms, shoulders, neck, jaw, or back. It's important to note that angina pain is typically temporary and often resolves with rest or medication. The most common cause of angina is coronary artery disease, or CAD. CAD is a condition where plaque builds up inside the coronary arteries, narrowing them and reducing blood flow to the heart. This buildup is like cholesterol forming a blockage in a pipe, gradually narrowing the passage. Angina is a warning sign that your heart isn't getting enough oxygen and should be addressed promptly by a healthcare professional. Understanding the different types, causes, and treatments of angina is crucial for both healthcare providers and individuals experiencing this condition. Angina is broadly classified into three main types: stable angina, unstable angina, and variant angina. Each type has unique characteristics, triggers, and implications for treatment. Stable angina is the most common type. It typically occurs during physical activity or emotional stress when the heart demands more oxygen. The pain is predictable and usually lasts for a short duration, often subsiding with rest or medication. Think of it like exertion causing a temporary strain, which eases with rest. Unstable angina is more serious and unpredictable. It can occur at rest or with minimal exertion and may not be relieved by rest or medication. This type of angina signals a higher risk of a heart attack and requires immediate medical attention. Imagine it as an unpredictable and escalating situation demanding urgent care. Variant angina, also known as Prince-Metals angina, is a rarer type caused by a temporary spasm of the coronary arteries restricting blood flow to the heart. It typically occurs at rest, often at night or in the early morning hours, and can be quite painful. This type is like a sudden spasm disrupting the otherwise normal flow. Understanding the difference between these types of angina is crucial for appropriate diagnosis and treatment. To understand angina, we need to delve into the pathophysiology behind this condition. Angina occurs when there's an imbalance between the heart muscle's demand for oxygen and the coronary artery's ability to supply it. Imagine your heart as a powerful engine that needs a constant supply of fuel to function correctly. Oxygen is the fuel, and the coronary arteries are the pipelines delivering this vital resource. When the demand for oxygen increases, such as during exercise or stress, the heart needs more fuel. However, in the presence of coronary artery disease, or CAD, the narrowed arteries restrict blood flow, much like a kink in a hose restricts water flow. This restriction limits the amount of oxygen-rich blood reaching the heart muscle, leading to an oxygen deficit. This oxygen deficit disrupts the normal metabolic processes within the heart cells, leading to the accumulation of waste products and the release of substances that trigger pain receptors. The result is the characteristic chest pain or discomfort we know as angina. Understanding the interplay between oxygen supply and demand, the role of coronary artery disease, and the physiological changes that occur during an angina episode is crucial for effective management and prevention. Certain factors can increase your risk of developing angina. These risk factors are categorized as either modifiable, meaning you can take steps to change them, or non-modifiable, meaning they cannot be altered. Non-modifiable risk factors are those you inherit or are beyond your control. These include age. The risk of angina increases with age. Gender. Men are at a higher risk of developing angina than women. Family history. Having a close relative with heart disease increases your risk. Modifiable risk factors are those you can control through lifestyle changes or medical treatment. These include smoking. Nicotine damages your blood vessels and increases your risk. High blood pressure. This puts extra strain on your heart and arteries. High cholesterol. Excess cholesterol can build up in your arteries, narrowing them. Diabetes. High blood sugar can damage your blood vessels. Obesity. Being overweight or obese increases your risk of heart disease. Physical inactivity. Regular exercise is crucial for heart health. Unhealthy diet. A diet high in saturated and trans fats, cholesterol, and sodium can increase your risk. By understanding and addressing these risk factors, you can significantly reduce your chances of developing angina and improve your overall heart health. Section 5. Diagnosing angina tests and procedures. Diagnosing angina typically involves a combination of a thorough medical history, physical examination, and diagnostic tests to evaluate your heart health and identify any underlying coronary artery disease. Medical history and physical examination. Your doctor will ask about your symptoms, medical history, and family history of heart disease. They will also check your blood pressure, heart rate, and listen to your heart and lungs for any abnormalities. Electrocardiogram or ECG. This test records the electrical activity of your heart and can help detect any irregularities in heart rhythm or evidence of a previous heart attack. Stress test. This test monitors your heart's activity while you exercise or take medication that mimics the effects of exercise. It helps determine how well your heart responds to increased oxygen demand. Echocardiogram. This test uses sound waves to create images of your heart, allowing your doctor to evaluate its structure and function and detect any abnormalities. Coronary angiography. This is a more invasive procedure where a thin tube is inserted into an artery in your groin or arm and guided to your heart. A special dye is injected to visualize the coronary arteries and identify any blockages. These diagnostic tests help your doctor confirm the diagnosis of angina, determine its severity, and guide treatment decisions. Section 6. Recognizing angina. Symptoms and clinical manifestations. Recognizing the symptoms of angina is crucial for seeking timely medical attention. While chest pain is the most common symptom, it can manifest in various ways, and its characteristics can provide clues about the type and severity of angina. Typical angina pain is often described as pressure, tightness, squeezing, or heaviness in the chest. It may feel like an elephant sitting on your chest or a tight band constricting your chest. Pain that may radiate to other areas. The pain can travel to your arms, especially the left arm, shoulders, neck, jaw, back, or upper abdomen. Pain that is usually triggered by exertion or stress. Physical activity, emotional stress, cold weather, or large meals can trigger angina. Pain that typically lasts for a few minutes. Angina pain usually subsides with rest or medication within 5 to 10 minutes. Other symptoms that may accompany angina include shortness of breath, nausea, fatigue, sweating, dizziness, and lightheadedness. It's important to note that not everyone with angina experiences the same symptoms, and some individuals may have atypical symptoms. If you experience any unusual chest discomfort or pain, it's always best to err on the side of caution and seek immediate medical attention. Section 7. Managing angina. Non-pharmacological and pharmacological approaches. Managing angina effectively involves a multifaceted approach that combines lifestyle modifications and medical therapies to reduce symptoms, improve heart health, and prevent complications. Non-pharmacological management, lifestyle modifications. Making healthy lifestyle changes is crucial for managing angina and improving overall heart health. These modifications include quitting smoking. Smoking damages your blood vessels and increases your risk of heart disease. Eating a heart-healthy diet. Focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit saturated and trans fats, cholesterol, sodium, and added sugars. Regular exercise. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Maintaining a healthy weight. Losing even a small amount of weight can benefit your heart health. Managing stress. Find healthy ways to cope with stress, such as exercise, relaxation techniques, or spending time with loved ones. Pharmacological management. Medications. Several medications can help manage angina by improving blood flow to the heart, reducing the heart's workload, or preventing blood clots. These medications include nitrates. These medications dilate the coronary arteries, improving blood flow to the heart. Beta blockers. These medications slow the heart rate and reduce blood pressure, decreasing the heart's workload. Calcium channel blockers. These medications relax the blood vessels and reduce the heart's workload. Antiplatelet medications. These medications prevent blood clots from forming, reducing the risk of a heart attack. Cholesterol-lowering medications. These medications help lower LDL or bad cholesterol levels, reducing plaque buildup in the arteries. Your doctor will recommend the most appropriate treatment plan based on the type and severity of your angina, your overall health, and other individual factors. Section 8. Surgical interventions for angina. In some cases, when lifestyle changes and medications are not enough to manage angina effectively, surgical interventions may be necessary to improve blood flow to the heart muscle. Angioplasty and stent placement. This minimally invasive procedure involves inserting a thin tube with a balloon on the tip into a narrowed coronary artery. The balloon is inflated to widen the artery, and a stent, which is a small, expandable metal mesh tube, may be implanted to keep the artery open. Coronary artery bypass grafting, or KABG. This surgical procedure involves taking a healthy blood vessel from another part of your body and using it to create a detour around a blocked coronary artery. This bypass allows blood to flow around the blockage, restoring blood flow to the heart muscle. The decision to recommend surgery depends on factors such as the severity of your coronary artery disease, your overall health, and other individual considerations. Your doctor will discuss the risks and benefits of each procedure and help you determine the best course of action. Section 9. Test your knowledge. NCLEX style practice questions. Here are some sample NCLEX style questions to test your understanding of angina. 1. A nurse is caring for a client experiencing angina. Which of the following positions would be most beneficial for this client? A. Supine with legs elevated. B. High Fowler's. C. Semi-Fowler's. D. Trendelenburg rationale. The correct answer is C. Semi-Fowler's. Semi-Fowler's position helps improve lung expansion and decreases venous return to the heart, reducing cardiac workload and potentially alleviating angina pain. 2. A client with a history of stable angina reports experiencing chest pain after walking up 2 flights of stairs. Which of the following medications should the nurse anticipate administering? A. Aspirin. B. Nitroglycerin. C. Morphine. D. Oxygen rationale. The correct answer is B. Nitroglycerin. Nitroglycerin is a vasodilator that relaxes and widens blood vessels, improving blood flow to the heart and relieving angina pain. 3. Which of the following statements made by a client with angina indicates a need for further teaching? A. I should stop smoking to improve my heart health. B. I can continue on my usual exercise routine even if I experience chest pain. C. I should follow a healthy diet low in saturated and trans fats. D. I should take my medications as prescribed by my doctor. Rationale. The correct answer is B. I can continue my usual exercise routine even if I experience chest pain. Clients with angina should stop exercising and rest if they experience chest pain. Continuing to exercise can worsen the condition and potentially lead to complications. 4. Which of the following is not a typical symptom of angina? A. Chest pain that feels like pressure or tightness. B. Pain that radiates to the arms, jaw or back. C. Sharp stabbing pain that worsens with deep breathing. D. Shortness of breath. Rationale. The correct answer is C. Sharp stabbing pain that worsens with deep breathing. This type of pain is more characteristic of pericarditis or other conditions, not angina. Section 10. Conclusion: your journey to NCLEX success. Mastering the concepts of angina is crucial for aspiring nurses preparing for the NCLEX. Understanding the different types, causes, risk factors, symptoms, and management strategies will equip you with the knowledge and confidence to provide safe and effective care to your future patients. Remember to utilize all available resources, including textbooks, study guides, practice questions, and online resources. Seek clarification from your instructors or mentors if you encounter any challenging concepts. Consistent effort, effective study habits, and a genuine desire to learn will undoubtedly lead you to success on your NCLEX journey.